it started in law school. In law school, when I arrived, I was very interested in just simply the practice of law, wanting to help people. Didn't have a focus on healthcare law. I was very interested in the law generally. And I had two lines of study. One was criminal law, and the other one was healthcare law. I was in the clinic, and one of the things that I enjoyed most about healthcare law is I had clients who were in need of help and support. The voice that I could bring to their issues made it very compelling for me. And as I moved towards graduation, I interviewed for criminal law positions and health law positions. I was fortunate enough to be given an opportunity to work at the Department of Health and Human Services. And in that capacity as a staff lawyer, beginning to work on a lot of the programs that they had in the department. And at that point, I started getting deeper and deeper involved in the wide array of health law, healthcare issues. Because at the Department of Health and Human Services, they covered everything, and not just reimbursement, but they covered the full suite of human services, Head Start, research through NIH, emergency preparedness through CDC. So it was really from cradle to grave, anything and everything that had to do with the provision of care, I got a chance to work on. And so, as I said, I started my career in going to law school, not necessarily focusing on health law, but it became a passion at that point. And through my time at HHS and beyond, I was able to really exercise that passion by working in all the programmatic areas.
You spent 28 years at HHS?
28 years, yes, sir.
14 as Deputy General Counsel.
Yes.
That had to be valuable experience. What were your takeaways from that?
One of I was fortunate, I think, to be able to have that pathway. And one of the takeaways was that healthcare and understanding healthcare and healthcare delivery is truly a patch quilt. It's part of the mosaic. You really can't understand what's going on with healthcare delivery without understanding the patient. And in that position, as the Deputy General Counsel, I had the opportunity to see the full array of services, how they're integrated within our delivery system here in America, and how it touches the patient. So that position, that platform, allowed me to see Head Start programs, maternal nutrition issues, well baby issues, through hospice. So every program and every element within the program, to and including products and services that relate to cosmetics and devices. So as I said, one of the unique things about that experience is I had an opportunity to truly follow patients from cradle to grave and all of the interactions along the way. I also got a chance to work with other departments that also had a piece of this. Indian Health Service for one, the education program, the Department of Education for another, and also to work with state and local governments. And so I would say I couldn't have had a better education than the 28 years at HHS.
And then you were in the private sector.
That's correct.
Advising hospitals and health systems and that sort of thing?
That's correct.
Another valuable experience.
It was a very valuable experience because it allowed me to take the education, the knowledge that I learned at HHS and apply it in the private sector, to take that package, the suite of services, the suite of knowledge, to talk to private sector clients about healthcare, health law on a much more holistic basis. It wasn't just one piece or another. I think one of the magical pieces of looking at healthcare and healthcare delivery is to be able to look soup to nuts. I use the phrase cradle to grave, but it is really having a conversation about the true integration of healthcare delivery. And even beyond just sort of the break-fix healthcare system, healthcare is also impacted by education, environment, some of the elements that are beyond the scope of HHS. Again, my experience at HHS allowed me to work with those other agencies. So in the private sector, being able to talk to clients and counsel clients on a much more holistic basis is one of the values, I think, that I was able to bring to that community again.
There have been some huge developments in health law over the past 50 years. I mean, how would you describe the most important developments in health law during your career?
Well, putting aside sort of the last 8 years where we, for the first time, have truly embraced health care for all, and how we get there is a sea change. Early in my career, when I was dealing with, well, in law school and dealing with individuals in the mental health arena, a sea change was the deinstitutionalization, where this country was realizing that individuals with mental disease and who needed some additional assistance didn't need to be institutionalized. That happened in the early part of my law school career and early on. So one side of the spectrum is that was huge, is sort of recognizing that individuals are individuals and their care pattern and delivery needs to be viewed on an individual basis. That was huge. And looking and working within state and state governments on how to break down large institutions where we warehoused individuals, many of whom didn't need to be there. Fast forward, working on programs that deal with homelessness, the individuals with drug addiction, and then fast forward to the very recent, period where we are actually providing health care and health coverage to many more people as a percentage than we ever have before, are major milestones in seeing how we've improved health care delivery in this country.
How would you characterize the role of the American Health Lawyers Association in responding to these changes and dealing with these changes, helping lawyers deal with these changes?
Well, the last phrase you mentioned is one of the key ones, and helping lawyers deal with these situations. I mean, one of the beauties of the American Health Lawyers Association is it is a place where we have truly been the leaders in healthcare education and helping the community, and not just lawyers, but helping the community understand and navigate the healthcare delivery system, health law. AHLA has always been at the forefront, and from not just this project, but we are an organization that has had the best of the best come to the table and share what they know to lift up the entire bar. And that, I think, has been one of the most amazing things in what this association has done. And they've done it in a nonpartisan way. I mean, whether it's been, and I can say that honestly from my years in the government, throughout, whether it was a Republican administration or Democratic administration, AHLA was always there as a place for the government to come and share, for the government to come and learn, as well as the private bar. And I don't think there's a place that has offered that kind of unique perspective, a unique opportunity to come together, grow, learn, share than AHLA.
How would you describe your perspective on health law and your goals for this association?
I would say the association has allowed me to bring to this office my experiences. My experiences may be different than others, but all experiences have been welcomed here. One of the things that is part of our mission is that if you are involved in healthcare, if you're involved in health law, you're welcome here. And I think that's true regardless of one's race, religion, or gender. You're welcome here. And so that fit very nicely with my own career pathway in wanting to make sure that any office I've been a part of or any organization I've been a part of, we've strived to be open and inclusive to everyone. And so coming here into this seat allowed me to continue to do what I do and what I've done. And that is to make sure that anything I'm involved in, any organization I've been involved in, is as open and inclusive as possible. And AHLA is committed to that. And that is important because this country, this world is an integrated delivery system, and everyone deserves a seat at the table.
You're in charge of crafting the strategic direction of the association. As you work at that, what are some of your priorities?
To continue to be open and inclusive. I look at our trajectory, I look at the market, I look at the health lawyers and health practitioners and think, we've got a tremendous opportunity to educate more and more people. And so when I work with the board and I work with our experts and I work with the staff on the strategic plan, I'm constantly looking for ways to not only broaden the reach of AHLA, but to do it in a way that has purpose, to do it in a way that continues to educate the community, to bring the community together, and to continue that kind of special relationship that we've had in the health law bar that started 50 years ago.
You talk about diversity, about inclusion, and I read that your work on the board of AHLA focused on efforts to increase diversity, to broaden participation among a range of different specialties, including non-lawyers, healthcare practitioners, and academicians. Tell me about that.
Well, when I began my affiliation with AHLA, I was a government lawyer, and it was important for me to make sure that the voice of the government was heard. We're a part of the mosaic of healthcare education, of health law, of practitioners. And like with anything, all sides of the coin, are important. And so I made it part of my mission to not only share what I know, to be as open as I possibly could, to be able to share the mission of the department with those who are affiliated with the association. When I left the practice of law for a little while and it was a policy wonk, it was also important for me to make sure that my staff, and I as well, took time to come out and share what we know, to share the department's mission. And so when I say, if you're involved in healthcare, if you're involved in health law, you have a place here, I truly mean that. And it's always been part of my sort of playbook, if you will, and that the table needs to hear all voices. Not just one, not just two, all voices, because the issues are complex. We can all learn and grow together. And the government at the time, to me, had an obligation in its healthcare promotion, healthcare education, to let the community know what we're doing and why. Our approaches may be a little different, but at the end of the day, I've always felt that we always share the same goal of improved quality healthcare delivery to all. And while we each have clients that we have to represent, and we represent them zealously, the common bond that brings us together is we're all interested at the end of the day of making sure that we have quality healthcare delivery. And that to me is the common bond. It's a glue that brings us around the table. And I've felt that since my earliest affiliation with the association.
I want to kind of expand on that, and you touched on this a little bit, but I'd like to ask you a little bit more about it. In a time of so much political partisanship on the issue of healthcare, how would you describe the role, the challenge, and the opportunity for this organization?
Well, on the one hand, complexity in the healthcare delivery system is always good for business, because the experts we have affiliated with our association break it down and can communicate to everyone about what's going on and to educate those who may not have ready access to other tools that may exist. But beyond that, it is a time of transition. We're always in a time of transition. We have a unique opportunity because our table is open to all, to bring practitioners around the table to listen and learn together, to grow together, and to prove the strength of the bar. It's an opportunity to educate those who are developing laws, rules, and regs. That's a role that we play. And we'll continue to play that role, because one of the things that's unique about AHLA is we have the best practitioners affiliated with this association. So, and we have folks who have been at the forefront of changes and developments through the history of the association, truly the history of health law education in America. So I see us continuing to have that leadership role. And I also see us having a place where folks feel comfortable coming around the table. Because again, it's not the left or it's not the right. The laws are the law, and education is education. We allow space for those who draft laws and regs to make those laws and regs, and where we step in is to help people understand the lay of the land, to help people understand what the laws are, what the regs are, advising our clients, but also educating those who are in the community. And then touching on a point I raised earlier, being a place where everybody can come and sit around the table, private practitioners, government lawyers, policy officials, to share, learn, and grow together.
How would you describe the culture of the AHLA?
Well, a phrase that I think you'll hear through many others is collegiality. It is one of the tenets within the association, and it's truly something that I've seen and experienced. I mean, when a government lawyer can stand up next to a private sector lawyer and share on a topic that's controversial, that's collegiality. Again, recognizing that we might have different perspectives, but at the end of the day, it's about quality health care and the goal of having a superior system. Sharing, is free and nonpartisan. At the end of the day, we will represent our clients, whatever side you're on, but understanding where we are, having a safe place to share, that's one of the hallmarks here. So it perhaps is a cliche, but it is true. And I think it's true when you look at our membership. I think it's true when you look at those who are presenting on the dais. Everyone has an opportunity to share, government, non-government, big law firms, small law firms, those who are affiliated with other associations, as well as other organizations. We truly attract people from all over because it is, I think, folks over our 50 years have realized this is an association that does walk the talk. Your voice is valuable, your voice is important, your voice is a necessary voice to be heard by colleagues who sit on the other side.
You guys were in New Orleans, and there's a video actually of you speaking about your public service work there. I want to ask you about the public service aspect of AHLA.
We, it is a thread that transcends the association. It's an opportunity to give back and give back to the community. In that video, it was a special opportunity for us to be able to work. And in fact, the organization that we were helping was a HRSA grantee. It had received funds from HRSA to provide a new facility down there. And, just like the New Orleans reference that you made, this past year we were in Charleston at a food bank. Public service is a thread that transcends the association. It's an opportunity to give back. It's an opportunity to give back and provide service to those in need. I think it's hard to be in the health law space, the healthcare space, and not have a desire to get beyond the courtroom, even to get beyond the classroom, to do a little sweat equity and provide an opportunity to give back to those who are in need, to touch those communities that are still struggling to provide care in their own community. So it was a special opportunity. It is something that we try to do on an annual basis within the board. It's something that we also try to urge all of our members to do, to give back into the community. And it is a passion that I have, but it is also part of the core fabric of the association.
On this 50th anniversary, with health law becoming ever more complex, how would you characterize the role of the American Health Lawyers Association?
If I would give one word to it, I would say leaders. We remain leaders, and yes, through the times that we see before us, they are complex. Health law in this country is complex. I think it'll always remain complex. But as we are leaders in the industry, as practitioners, I think we will maintain that position. We'll maintain that position as an educator. We will maintain that position as a facilitator. One of the, again, hallmarks of the association is bringing the parties around the table. It isn't an association that's just for law firms. It isn't an association that's just for big law firms. As I said, everybody who's interested and who has a passion about health law and healthcare has a seat at the table, has a home here. We'll continue that. And I would say, yes, the complexity of healthcare delivery may make it easier for folks to come to us. But more than anything, we have created over the years a safe place, an inviting place for practitioners from all sides to come, listen, learn, network together. At the end of the day, then I think we are better able to help and work and service our clients, leading towards better quality care, safer environments for our patients. And I truly came to that, I think, by being at the department where we were dealing with the healthcare delivery system from soup to nuts. It's not just one touch point. I've always urged folks to truly follow the patients, understand the needs, and translate that information to our clients, wherever the clients are. And AHLA will continue to be leaders in that space.
We've talked about the history and the milestones and that sort of thing. What does the future look like?
I think the future is bright. when I look back over the 50 years, and I look back over the 50 years or more of history of healthcare in this country and how we've changed and how the health lawyers have always been a part of that in a leadership role, in a convening capacity, I think that will continue. It's hard to see how that trajectory changes dramatically. I guess, I was thinking, maybe if healthcare just was so easy, there would be no role. I can't envision that. Clients continually need guidance in how to navigate. The rules change, but also technology continues to force us to change. And so as technology continues to drive innovation in creative ways of providing more nuanced care, better care, there's a role for lawyers to help guide the community, to help explain the rules and engage in the transactions that are necessary to allow the practitioners to do what they do. I see healthcare delivery evolving constantly. As I said, innovation, technology, computerization, precision medicine. When you look back 50 years ago, when you look back 20 years ago, things were very different. So I think when you look forward 10 years, 20 years, 50 years, it's hard to know what the future is going to look like. What we do know is it'll be very different than it is today. Therefore, there's a role for us. There's a role for health lawyers. There's a role for this organization and those individuals who are affiliated with us to continue to guide, educate clients, the government, through the pathway of making sure that we're always there and that we're an integral part of improving the healthcare delivery system in the country.
Excellent. Anything you want to add?
I would add one thing. Having an opportunity to reflect, which is what a history project does, allows us not only to give thanks to those who've led the way, but also to highlight what the path forward might look like, and that is to continue to be open and inviting, inclusive. That gives us our strength. It was our strength, and it will allow us to be relevant into the future. And so at that pause point that we have right now, to sort of look and reflect on where we were, to see what we've done in this changing environment, I think is a pretty clear indication of what the future will look like. And I think it'll be more of the same, more and more inclusion, growth, and continuing to have a critical role in the future of healthcare and healthcare delivery. I think my perspective on health law doesn't really change. I haven't viewed it through the lens as the first African-American CEO here. I think the footprint for health law is the footprint for health law. If there's anything that's unique to my perspective, it's the journey that I have as an African-American patient, lawyer, and so I bring to the table the sum total of the experiences I've had and try to incorporate those into how I manage, how I guide, how I lead. But health law as a discipline, as a practitioner, is the same. It may have, and probably does to a large extent, influence how I view opportunities for others and why it's so important for me to be an association that has at the core of its mission inclusion. So, it's not just race and ethnicity and gender. If you are involved in health law, if you're involved in health care, this is truly an association where you have a home here. These are not just words on the page. It's part of the mission statement. It's part of the mission statement before I became the CEO. This is an association that I believe has a deep-rooted commitment to being inclusive and for creating opportunities for everybody.
What have been your goals for this association?
In this regard, to make sure that the association remains as inclusive and open as it is, and to be even more so. As I said, everyone and anybody involved in or interested in health law and health care has a home here. And goals in that regard are that we continue to live that out, and to make that really, a living and lasting legacy for the association. Other goals for the association are truly to continue to be the premier legal education association in the country. And as healthcare continues to be exported around the globe, that we might also play a role in that. As I said, through our history, as healthcare has evolved and grown, we've always been there. We've played a part. Our membership are the best of the best practitioners in this area. And I have a goal of maintaining that and to making sure that the association grows and has continued to be the go-to association for anyone and everyone who's interested in health law and in healthcare, to understand what it is that's being offered through this country, and that our clients, our collective clients, are served optimally because we are a quality institution providing great care and great education for everybody. What it means to me, and I hope it means to our members, is if you have a question, this is the place to get the answer. If you need guidance, this is the place to go. This is a place that nurtures thought, is a safe place for exchange of ideas. Because at the end of the day, we may be sitting on opposite sides of the table representing our clients. But in this space, in this association, it is an opportunity for us to grow together, learn together, and to be a strong, vibrant, sort of connective entity that creates that safe environment for people. This is not an association that is just for big law, big reimbursement, big fraud. I mean, to truly understand healthcare delivery, it is from soup to nuts. It's anything and everything associated with healthcare. So it is the big law firms as well as the solo practitioners. It is compliance officers. It's in-house. It's government at all levels, not just the federal government, but also those at the state and local level. As I said, healthcare is local, healthcare is national, healthcare is international. It is my goal and expectation that AHLA will continue to be a vital part in the education of all those practitioners in there. And you don't have to be a lawyer to be a member of the association. Many people who are engaged in the practice or working with clients in healthcare and health law are specialists in their own right. They're not lawyers. You don't have to be a lawyer to be a member here. And so, when I talk about our goals and our outlook, and I talk about the future, this truly is a place for all those who strive to learn and improve their craft to be able to be better practitioners, whether you're a lawyer or non-lawyer, providing counsel and advice to your clients. This is the place for you.
In the world at large, outside of this room and outside of this association, there's so much political partisanship about healthcare.
Yeah.
What challenge does that present to this organization, or what opportunity does that present to this organization?
I think it creates challenges and opportunities, and the opportunities is, as a nonprofit organization where everyone is invited to the table, we don't lean to the right or to the left. We educate and provide valuable information to practitioners and members and non-members. So, the opportunity is still there for us in a highly politicized world and a highly complex healthcare delivery system, is to be exactly where we are, to be able to provide education and opportunities. The challenges exist, and maybe, again, my background and years at HHS, where I worked for Republicans as well as Democrats. The law is the law, the policy is the policy. It may change from here to there. But at the end of the day, our goal is to educate the practitioner so that they're able to provide counsel and advice to their clients. We do that whether there's a Republican in power or a Democrat in power. So some may see that as a challenge. It's one that we manage very well. If we were partisan, I think our value and reputation would not be as sterling as it is. We would be marginalized and compromised. I think for us to continue to be the vital go-to association is to be exactly where we are, not leaning to the left or to the right, but making sure that we are providing the best education possible to lawyers and non-lawyers, to practitioners in health law and in healthcare.
Does that make your brand even more powerful?
I think it elevates it tremendously, yes. Because again, as the pendulum does swing, it will always swing. But if you swing with the pendulum, your value is compromised. People are likely not to trust what you say when the pendulum swings away from where you are. I think the fact that we have a vital and strong brand is in large part because we embrace everyone here, we give voice to everyone here. Without doing that, I think we would be compromised.